I want you to connect to your breath and use this style of breathing now that you're in active labor. Congratulations, you're in labor. You've started to feel contractions, and what we're going to use is this breath pattern to begin breathing into those contractions, helping baby move down the birth canal into the pelvis with more ease by using your diaphragm. This is also going to help the pelvic floor open. So I want you to connect to your breath and use this style of breathing now that you're in active labor. We're going to begin with putting our hands on our belly. And to whatever your capacity is, you're going to breathe into your hands, allowing your belly to rise when you inhale. So you're going to inhale. The air is going into the belly. You're not forcing the air to go into the belly. You're just allowing the air to go into the belly. Exhale and let it go. Inhale into belly. Exhale and let it go. What you're doing here is every inhale, as the air fills the lungs, the diaphragm, the muscle underneath the rib cage, is descending into the belly. When that descent happens, that diaphragm, the muscle of the diaphragm, is putting down pressure on top of the uterus. So when the uterus is contracting, that muscle is pushing down, helping move baby down into the birth canal on top of the muscle, also helping make these contractions more manageable. When you use this style of breathing, it's going to help stimulate the vagus nerve, which can help make you in a more peaceful state of mind, in the rest and digest nervous system, which we call the parasympathetics, and it helps keep our bodies relaxed. So you're going to, again, breathe into belly, inhale and open, exhale and let it go. We're going to take this breath pattern a little deeper. You're going to breathe down into your pelvic floor now. The pelvic floor is the bowl of muscles that includes the vagina, the anus, and the urethra, and the baby's going to come out of the vagina. So we want to open and relax these muscles so that they can be melted and open and kind of buttery and smooth, so that the uterus can do its job of pushing baby down and out through the birth canal. However, if we're tight through our pelvic floor, it's a little harder for the uterus to work to get the baby down and out. So we're going to use some breathing to help open up the pelvic floor muscles. And this same breathing is what you use to help breathe baby down during your active labor and during your contractions. Now you can do this breath between contractions and during the contractions. It's not just for just when you're contracting. It's to be used the whole entire labor. You're gonna lock in mentally with this type of breath pattern. So here we go. We're inhaling into our bellies, allowing the belly to open. Exhale and let it go. We're gonna take this a step further. You're gonna inhale down into the vagina. You're gonna inhale into vagina, inhale and open. Exhale and let it go. You're gonna feel some recoil. If you can't feel your vagina opening, try opening your anus. It's the same muscle group, just on the backside. So you're gonna inhale and open the anus. The air is filling the belly, opening anus. Exhale and let it go. Inhale and open. Exhale and let it go. You're imagining that your vagina is a rosebud. And on the inhale, we want to flower and blossom the entire rose so we can see every single petal of the flower. Again, this is going to help you open so you can get baby efficiently out of your pelvis. In our clinic here, what we do is we put people in different positions to see where they have the best opening. And you can find that in your body as well. You can find, where do I feel like I have the most control of this? Is it on all fours? Is it in a flat back position? Where are you finding that you have the most control to open the pelvic floor? And then we also, before people are in labor, we work on opening these muscles up so that they're ready to open and expand as baby's coming down through the birth canal. This helps decrease the risk of tearing, and this helps decrease the push time. So now, once you're ready to start pushing and you've breathed baby down into the birth canal, whether this has taken 10 hours or 48 hours, labor can be all different lengths, but you're using this breath pattern to bring baby down and you're using this breath pattern to open pelvic floor. Now, once you get the intense rectal pressure, like you have to poop and there is no way you can hold this poop in, that's how you know that you're ready to push a baby out. Now, some people do opt to getting cervical checks and will opt to have their cervix checked for effacement, meaning how thin the cervix is and how dilated the cervix is. And usually if you're fully effaced and 10 centimeters dilated, they tell you you're ready to start pushing. But really, it's best to go within your body and feel that deep, intense rectal pressure. And yes, you will also feel this when you have an epidural. And you can use this type of breathing to breathe baby down and out when you have an epidural as well. Okay, so now we're gonna breathe baby out. You're gonna take a nice deep breath in, into belly, diaphragm is descended, pelvic floor is opening, and you're gonna exhale and let it go. Try and stay open in your pelvic floor as you exhale. And then on the next one, we're gonna gently push. So this is where we'll be volitionally pushing. So if your pelvic floor isn't open and relaxed enough in order for uterus to push baby out, sometimes you will have to volitionally push baby out. And we do this without breath holding, because without breath holding, it's gonna help keep maintain the integrity of the perineal tissue and help decrease the tearing. So we're gonna inhale and open. And at the very top of the inhale, when your lungs are completely full of air, you can begin to bear down like you're trying to fart or poop. And then exhale and let it go. And then if you don't feel a lot of bearing down or bulging with that, you can add sounds to that. So you can inhale and open. And then at the top of the inhale, as you begin to exhale, you can moo. Really deep, really loud, and feel the opening of your throat and the opening of your pelvic floor to help bring baby down. And you can do your pushing with a moo sound. You can explore, if the moo sound isn't working for you, you can explore doing a grrr sound or a really deep opening sound. And that can also help you get the bearing down and the opening of the pelvic floor. So let's just repeat this one more time. You begin contracting, even if they're Braxton Hicks contractions. I want you to begin this type of inhale. You're gonna breathe into belly. Most of the air is going into belly, trying to keep the chest fairly relaxed. Exhale and let it go. Inhale into belly. Feel vagina open. Exhale and let it go. You're gonna just lock into this type of breathing. And now we've gone through transition, we've made it through these intense contractions, and now we're ready to begin the pushing. And if your body can't continue to just breathe baby out because the pelvic floor isn't open enough and you feel like you need to do some volitional pushing, you can do the moo or the grr sound along with bearing down like you're trying to fart or poop. And it's not like a big pressure push. It's more of just a lengthening and an opening. And that is why it is best to practice this before labor. But if you're just seeing this video while you're in the thralls of labor, then go into the sounds and see if you can get the opening and the pushing with the sounds. So you're gonna inhale and open again. And at the top of the inhale, moo. Exhale and let it go, everything go. And you wanna be doing this with the contraction. So if you're trying to push without the contraction, you're not gonna have the help of the uterus. So make sure that you're doing this with the contraction. You're gonna inhale, feel that contraction, and feel the throat opening. You have to find what sound works better for you and where you feel that more, where you feel the opening most. If you're using higher pitched sounds like, oh, hi, 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 that's gonna cause narrowing of the throat and narrowing of the pelvic floor. So we wanna make sure we get the opening of the throat and opening of the pelvic floor. I'm Dr. Allison Felt. Thank you for joining me today. I own Body Motion Physical Therapy, and we help people have better births and better labor experiences and help them breathe their baby out and avoid hours of pushing and tearing. that can lead to a much faster postpartum recovery. You can check out my book, Pregnancy Era, The Secret to a Tear-Free Birth and Fast Postpartum Recovery. If you found this video helpful and you want more tips throughout your pregnancy and or your postpartum recovery and through menopause to live your ultimate best life as a woman, check out this YouTube channel and subscribe. We are constantly releasing videos to help you live your best life. Take care.